to be here. I didn't think I'd be doing this over Zoom, but we have COVID, so that's what we're doing to keep everybody safe. I'm Kate Lundgren. I'm the owner and clinical director of Cutting Edge Pediatric and Adult Therapy. Go ahead, Nicole. So this is a picture of me many years ago because I look younger and I have different classes. But anyway, that's what us old people do. We keep pictures of ourselves that are younger, so we can look younger. But anyway, Joe and I started Cutting Edge Pediatric and Adult Therapy in June of 2013. I had been an OT at that point for close to maybe 28 years at that point. It's closer to 35 now. And I had worked with many special needs children, and I also am the parent of two sons on the autism spectrum. So I kind of have the parent perspective along with the therapist perspective. And I think I drove my employers crazy because I'm like, why don't you do this? Why don't you do that? My whole goal was to make it as easy as possible on the parent, but provide very robust services in our centers. So we opened our doors in June of 2013 over here in Allen, and we had a very small facility. I think it was about maybe 2,500 square feet. And we only had occupational therapy. To date, let's see, this is 2020, right? Okay, so it's 2020. We opened 3 locations. So we have the one in Allen, and the one in Allen has moved to a new location that we built. And so we moved from that 2,500 square foot facility, which went to about a 5,000 square foot facility, to 13,000 square feet. And we are building a behavior center offering ABA services on the back. So that's what's happening in Allen. After that, we piloted a center in Houston, which is about 5,000 square feet in the Katy area. And then our final opening was, God, Nicole, was it 2017? Does that sound right? Summer of 2017, we opened up Mansfield. And the reason we went to Mansfield is I had families driving from Fort Worth to Allen. And I thought, that's absolutely ridiculous. Why would you drive? We are open 6 days a week. We do a half day on Saturday, and they would all drive over on Saturday for their services. So I just decided, I don't know why people are doing that. Maybe I can find a provider for them to go to. Well, in my journey to find a provider, I didn't find one. So instead, that was in about 2015. Instead, I decided to open a center. And we looked all over Grand Prairie. We looked over all different places. We ended up in the little town of Mansfield, which we love. And so Nicole is the office manager of that center, which is about 4,500 square feet, which we will be purchasing land probably next year and building because she's almost to capacity at that center. So I added speech and PT services about 2 to 2.5 years after I opened. And so we are a full service center. And when Nicole moves, we will move our ABA model over to the Mansfield location. So they will be able to have all those services. So that's kind of the quick version story of how we developed. And again, I have my oldest son is Asperger's, and he is 27 years old. And then my younger son is 24, and he has autism. Now, I know this group is focused on Down syndrome. We have many, many clients in our centers that have Down syndrome. So the treatment protocols don't change that much. It's just the way we deliver the service and how we prompt and do things that are a little different. So we see all kinds of disorders, ADD, ADHD, autism, Down syndrome, genetic disorders, CP, all different types of disorders. We have kids in wheelchairs that we work with. We have kids that have no language. We have kids that have Down syndrome and autism. So our therapists are very focused on working in those areas. We also work from infancy up until the age of 30. So I never understood what was magical about being 18 or 21 when you have a developmental disability. It just makes no sense to me. Maybe that makes sense to funding sources, but honestly, I think some of our young adults embrace treatment more than our younger kids. So we have been able to work on pre-vocational skills, pre-employment, activities of daily living to make them more independent. All of our locations have a transition to adulthood apartment. So we're not treating our littles where we're treating our young adults. It's very important for their own dignity and where they are in their lives to be able to have a space that's appropriate for them. So we have a transition to adulthood apartment. It's got, washer dryer, cooking facilities, Murphy bed, full bathroom for showering and bathing. Grooming and hygiene is a really important issue if you're going to be employable. So we're working on those different things. And I think sometimes our younger clinicians are more effective with our young adults because they can relate a little better than we can as parents, and they are more compliant. But we're teaching teeth brushing, flossing, shaving, all of those different activities. So we want to make sure that we're able to improve their fine motor skills, their gross motor skills, and that carries over into their activities of daily living and their pre-employment. Next screen, Nicole. Okay, so again, we offer occupational speech, physical therapy, and we have ABA services in aquatics in Allen right now, and those will probably transfer to our Mansfield location, which is closer to where you guys are when we open that new facility. We're really looking at piloting that land the first part of 2021. So let's talk a little bit about occupational therapy services. I am an occupational therapist, so this is near and dear to my heart. Our clinics tend to be very sensory based. A lot of our kids with developmental disabilities have a lot of sensory dysregulation or emotional dysregulation, where a good example I can give you is they react the same to a problem, whether it's a small problem or it's a giant problem, or they have no ability to problem solve a situation and come up with a conclusion. So in occupational therapy, we're looking at promoting health, well-being, and independence through occupations and the activities we do on a daily basis. And that's the job of living. These are things you do every day. This is work, play, and leisure. Many of our little kids don't even know how to play. How do you engage and play with somebody where it's interactive? And so we have some fun pictures of our therapists working together. The other neat thing that we're able to do in our centers with certain insurance coverage is we're able to do co-treatments where we actually have a PT and a speech therapist together working. So it's, or they can overlap maybe for 30 minutes of the session, which makes it a little more intensive. So we can engage them in multiple areas. Go ahead, Nicole. So some of the areas that occupational therapy is going to work on is, like I said, activities of daily living or those self-help skills. Also, any adaptations you might need to be successful in home and school. Feeding and oral motor needs, fine motor skills, buttoning, zippers, all those different things. Handwriting skills, grasp, visual motor and visual perceptual. And this is my ability. A good example I can give you of this is how, if I give you a maze, can you get to the beginning to the end and figure out how that works? Or maybe I ask you, how do you get from the kitchen in your house to the bathroom or to your bedroom? So that's a good example of visual motor or visual perceptual skills. Motor planning, and motor planning is things like, if I'm going to do this activity, I have to reach with my hands first and then my feet, and they have to work together. So in our gyms, we have a lot of suspended equipment, swings, um, different obstacle courses that they're having to move through. We did have ball pits until COVID, and all the balls are now dead. Right, Amanda? They're dead. We got rid of the balls because it's not COVID friendly. But play and social skills. Play is the occupation of smaller children, but social skills is so important when they start going into puberty and being able to make friends and sustain those relationships. We do a lot of parent training. Right now we're on telehealth, so we're doing really a lot of parent training, which has been great. School observations and strategies to develop programs. We work very closely with the school district, with school-based therapists. Maybe they're in speech in school and they're in speech privately. We will work together and divide up that plan of care and try to be congruent in what we're doing with them. Maybe your kiddo's nonverbal and they're on a device. It's important that everybody's using the device the same way, because what we know is if we're not instructing the same way, we're not going to get generalization of skills. Self-regulation and attention skills. So self-regulation is like what I talked to you about, where you asked me to take my shoes off and I had a meltdown. So we have to figure out how we can transition clients and work on things with them being able to understand their own body and how their body's feeling. When you asked me to go from here to here, that put me into fight or flight. And so I went from green zone to red zone. What things can I do to calm myself down? So there becomes some training and ownership in knowing your body and how you work with your body. Also, attention skills. We have some kids that can't sit at a table longer than 15 seconds. We work on sustained engagement because in order to be even successful in school, you have to have a sustained engagement. Sensory integration for home and school. So we have a lot of sensory modalities in our clinic. We're very sensory based. That's probably one of our strongest areas that we work on. And then overall strength and endurance so that you can participate in PE and different activities. So speech therapy, and this is probably, I think OT is our largest service. Speech is probably our second largest service. Speech and language pathologists help clients overcome barriers to communication and eating. So you're going to find in these slides there's overlap. OTs work on feeding, but also speech therapists work on feeding. So speech and language therapy consists of specialized intervention to allow the client to gain appropriate communication, language, articulation, which is the way you say the word, feeding, and oral motor planning skills. So some of the areas that speech and language provide evaluation and treatment for are receptive and expressive language delays. So a receptive and expressive language delay is if I'm speaking to you, can you understand what I'm saying? Maybe you can't express, but you understand completely what I'm saying. Or the expressive is maybe you can express all you want, but you're not understanding what I'm saying to you. So it's your ability to speak and your ability to be able to understand language. Because in a conversation, it's somebody speaking, somebody listening, and then it's somebody speaking and somebody listening. And that's the way the language goes. Also, pragmatic language. Pragmatic language is the language that our clients use that are completely verbal but struggle with social skills. So I like to define it as the who, what, when, where, and why of language. So how if your facial expression doesn't match what you're saying, what does that mean to me and how am I supposed to respond? This is a very complex area because social pragmatic rules change based on the setting you're in. So we work on a lot of, again, social skills training to work on that. Also, auditory processing. Am I able to understand the lecture if somebody's just speaking to me, or do I have to have a visual cue to follow? Autism and other related disorders, pre-linguistic, which is pre-speaking skills, paralinguistic skills, speech apraxia, which is apraxia is a motor planning term. So that does my mouth move to be able to produce the sounds I need to say? Or articulation, can somebody understand me? Am I not pronouncing my letters correctly? Stuttering and fluency, tongue thrust, we see a lot of tongue thrust in cerebral palsy, oral motor and feeding. So this is an area where OT and PT cross. We have many clients in our clinic that are picky eaters. They eat maybe 5 items. The most common items I hear are things like, and it's pretty brand specific, Tyson chicken nuggets, goldfish, cheese, no fruits, no vegetables. There might be maybe one fruit. And it's chicken nuggets because that is almost what I call pre-digested protein. They don't have the ability in their mouth or the oral motor skills to be able to break up that food. So feeding is a huge, huge issue. And if you start working on textures, a lot of this falls in the sensory realm. So is it that they have an aversion or do they have a texture aversion? And do we need to introduce those textures in a way? And many of our feeding therapists don't even start putting food in the mouth for a while. We're touching it. Sometimes it's being in the same room with it. Honestly, I have kids that if you bring the wrong item in, they're going to vomit on the table, even being in the room with it. So we touch it, we color with it, we play with it. I mean, babies, if you think about babies, when babies are learning to eat, the tray's full of everything and they're mashing it. That's part of the normal developmental process. So we're trying to desensitize and reintroduce in a very safe environment. We don't force feed kids. They're allowed to be able to take a little, we call them snake bites, stick your tongue out, touch it, and then you can dump it in the trash. We appreciate the fact that you tried that for us. So feeding is a big, big issue. So somebody asked, what's the youngest client we accept at Cutting Edge? We have babies with torticollis. So that can be a 2-month-old baby all the way up to the age of 30. We take them past 30 on a case-by-case basis. Also, augmentative and alternative communication. Our speech and language pathologists are actually deciding the device for those kiddos that aren't able to speak. We have to give our clients that aren't able to speak a voice. And so we do that through device, and we evaluate as a team. The OT will look at, if they're an OT, what is their ability to be able to finger isolate and use that device. Then the speech therapist might say, hey, I think this setup is going to work well for them. And so we work together to develop that process for us. And then voice, we're also working, so many of our clients speak, but they have very strange voice inflections. And you don't realize until you hear somebody that speaks differently or robotic, how impacting that is for them. And then cognition, so attention, sequencing, and problem solving. And that's another area where OT and speech cross over. So that's why it's real fun when we co-treat, right? Mm-hmm. Thanks, Nicole. You can go to the next slide. Okay, so then physical therapy. This was the last service we added in. And in Allen, we have a pool. So you see our pool there. And I just did a pool session last hour that I co-treated with PT. Also, this rock climbing wall, is that yours, Nicole? I think it is, isn't it?
Ours.
That's Nicole's. And so our PTs, our pediatric physical therapists, and they work with adults and young adults. So I call them lifespan therapists, although they do specialize in pediatrics to be able to work with that attention and be able to engage. Remember, a pediatric therapist role is really to be able to engage that client and make it fun. So they will specialize in assisting children to reach their full potential, to safely and independently, and to promote active participation in homeschool and community. We have a lot of special needs kiddos we work with that are so deconditioned, even their whole posture. So for them to sit up at a desk all day is a struggle. So we work on a lot of core strengthening and gross motor skills. They're generally referred to physical therapy when they exhibit delays in motor milestones, rolling over, crawling, or deficit in age-appropriate gross motor skills, walking, running, and negotiating stairs. And I must say, as a parent, sometimes I underestimate how poorly my kids do things, because I'm like, well, they're getting from point A to point B, but how does it look for them to get from point A to point B, right? We want it to be somewhere in an area that's close to their peers. Or loss of skills following an insult or injury affecting their function. That could be a traumatic brain injury or something like that. So the PTs are working on all those motor abilities. And, if you're going to school or doing things at school at all, you have to participate in PE and all those different activities. So in our Allen location, the picture below the pool is our PT meets PT. And we offer a group where our physical therapist works with a personal trainer and they work out as a group. And that's something we just do free of service. If they're clients with us, they can attend that. So some of the areas that physical therapy will evaluate and treat is the gross motor skills and muscle tone, strength and endurance, posture and body alignment. These are big areas. If you don't have proper posture and body alignment, you're going to have conditions that develop later in life. Movement and mobility, pre-gait, which is walking, and gait training, locomotion patterns, walking, skipping, running, all those different things. Can your limbs move opposite of your legs? Can your right move opposite of your left? So they do extensive testing to see where you're fitting in the developmental milestones. Neuromuscular function, musculoskeletal, splinting, bracing, and orthotics. And like I said, torticollis and flagiocephaly. So those kiddos that are born with the be helmet head, and they have to work on that control piece. So this is our Allen location. And we have a sensory light room that's all the way on the one side of the screen, which is really fun. And then we have a very large playground outside that you're seeing. We have a lower one for our kids that might be wheelchair bound or might have limited physical ability. And then we have a higher one. The cute dog in the middle is our therapy dog, Rocky, and he attends the clinic twice a week. And the kids love him, and he's a huge reinforcer for the kids because he goes on all the equipment. So they think that's really great. The picture that's next to Rocky is one of our obstacle courses. And so you can see the swings in there, and they're supposed to navigate that obstacle course without touching the mattresses below. So it's quite a motor challenge that can go on there. Then we have one of our kiddos that graduated, and he's got his poster there. And this was our, oh, Nicole, isn't this our Down syndrome rock your socks or whatever? We're all wearing our fun socks there for that. So this is the therapists all participating in that activity. This is our Katy location, and it's just fun to see pictures of treatment. It gives you a feel for a place. So this is one of our therapists, and our students is all the way on the far side of the screen. They're on a scooter board, and they're having to use that rope to get from point A to point B and pull objects off. Then one of our marketing events, this is one of our walks that we did. And then we have our PT Carrie working, you can see her working on motor skills with the OT. And then we have pictures of the rock climbing walls and the different structures we have. And then there's a great picture of PT and speech working together in the bottom one with the kiddo over the ball, and he's working on a language activity. And here's Mansfield, which is the clinic closest to you guys. We have Beth and Karen, that's speech and PT at one of our events. I forget what event that was, Nicole. Do you remember?
That was Pitt Hopkins.
Okay. And then I know we had a great picture of Stand Up for Downs, didn't we? When I wish we'd had that one with Milan dancing. So you can see the picture at the top below Mansfield has one of the gyms that we have there. It's large. That's the largest gym we have of any of our locations. And it's got zip lines and obstacle courses and treadmills and fine motor activities. Then we have another picture of one of our kiddos in Mansfield. He's actually working on an activity with a speech language therapist that you're seeing there. And then the picture, I have to move this down. Then we have, we do a thing called, is this Sensory Friendly Friday Night, Nicole?
Yep.
So this picture is of one of our the kiddos working on our Sensory Friendly Friday Night. We offer this as respite for our families. And so the kiddos can come for a Friday evening for a couple hours, and they make it like a camp. It's really, really cool. And then there's also a picture of the other gym with the rock wall and the slide and different things. And then one of our therapists working on the treadmill. Okay, and then some of the additional events that we offer at our locations is our summer camps. Every year, each location is a summer camp that is a week long that focuses on speech and language and developmental skills, as well as gross and fine motor skills. So actually at Sensory, I think that's Sensory Friendly Friday Night in the top right corner. And then you see some of our camps. We are really hoping that we're able to offer camp because our camps are amazing. We actually have a gal that comes out with a therapy horse and a therapy dog, and our kids get to color and paint this horse. It's a miniature. I think it's 21 inches tall. So it's amazing. And then we do our social skills groups, and of course our sensory friendly Friday night that I told you about, that our volunteers and our therapists choose to work to contribute to our community. So this shows our locations and our contact information. That was our autism awareness picture in Allen. And we also offer I'm posting a lot, and the therapists are on a blog. So if you go to our website or our social media, you'll be able to see that blog. We also on our website, I don't know, Nicole, did you do a thing with our new developmental checklist?
Oh, I don't have it on here.
Okay, so if you go to our website, we just added a couple months ago a developmental checklist. and it's by age, and it's geared primarily for, I think it's 2 through 6. And you can go through by area. It has OT, PT, speech, and sensory. And you can put in where your kid's at, and it'll identify whether you probably need a screening or assessment.
I also have the therapist put this together.
So the home activities?
Yes.
Okay, so these are some different things. We always like to give a takeaway to anybody that's attending, because really you want to know what to do, and especially what to do when you're at home with your kids, because apparently they're all not in school, right? So we want to know what to do. So speech, are if your kiddo's needing to work on expressive and receptive language, some of the fun activities we do are balloons and bubbles. So have the child request more. So if you're doing balloons and bubbles, get them to do their language for you to blow more bubbles or for you to throw the balloon. So you can, any activity you can do that's going to have them request is really, really important. We have doll houses, and so some of that is following directions with or without spatial terms. So put the doll in the bed, put the doll next to, by the door, these different things. Pretend play is a big thing, a big functional thing that our kiddos need to be doing. Also, book reading. I think you guys, Nicole, didn't you guys do a big thing on reading books?
Yeah, we read books before Sunday night.
Yes, that's a lot of language stuff comes out of reading books. Cars, the kids can request the car to go, to stop. All that is producing language for them. And then farm animals has always been a biggie. The kid can work on labeling, identifying the animal, the sound they make, following directions for appropriate play. Thanks, Nicole. Let me see. So OT is going to work on a lot of fine motor, tactile, handwriting, visual perceptual. So we have a toy washing station where they have to wash the dolls or clean what they worked on. One of the big things we do in treatment is if the kiddo is using that different toy or whatever, they're responsible for cleaning it up. Part of the process is cleanup. So we include that in what we do every day. Toy rescue, wrap small toys or small objects in masking or painter's tape. Or sometimes you can stick them in Play-Doh too. I like Play-Doh. Find the different color beads or things out of Play-Doh. That does a lot of fine motor manipulation. Or mini rubber bands, and then have the child rescue the toy. I think this is what we're doing a lot in telehealth right now. Notes, write note cards or letters to family members during this time. Thank you notes to essential workers. These are things that you can work on at home right now while maybe they're not getting their therapy. I love I Spy, going on a scavenger hunt. We do scavenger hunts with many different things. So you can hide items in a room and have them find it. So for some physical therapy things for balance, motor planning, depth perception, strengthening, those types of things, climbing up and down the stairs. And look at the way they climb up and down the stairs. Are they able to alternate their feet? Are they holding onto a handrail? Progressing to be able to climb stairs, placing one foot on each step. On hands or knees, a kid can also crawl over pillows on the floor. Walking backwards, pulling a toy or a wagon, trying walking along a surface like a balance beam or a curve. You can also try walking on a line or heel to toe. Try slow walking or uneven surfaces such as pillows on the floor or a surface that is up and down an incline. Sometimes if you guys have driveways, that'll provide a natural incline. Ball activities, throwing a tennis ball or a beanbag at a target. Look at your distances. Can they do it at 2 feet? Can they do it at 4 feet? Can they do it at 6 feet? Can they do it at 8 feet? Could be throwing into a basket on the floor, kicking a ball towards a soccer goal or a laundry basket, then having them try to kick the ball that is rolled to them. So you're going to roll the ball and you're going to see if they can kick it with their dominant foot at a target and whether it goes straight or not, and how far it goes. And then strengthening is always a good thing. I think we're all doing strengthening still with this. Have their child sit on a small step or bench with their feet on the floor. Reach the floor to pick up an object such as a toy or a puzzle. So you can do a puzzle activity where they have to do this to make the puzzle, and then have them resume sitting with greater control. Also, yoga postures. There are some great online yoga things. Kids can include the crane, march around the zoo, star, or gorilla. You can even do that with music, but there's a lot of great YouTube videos and apps like Yogorilla where they can do yoga. So that's another nice area that they're able to continue to engage in activity, but you can make it fun and therapeutic. And it's not super hard. Many families have a lot of these supplies at home. So that is the end of the presentation. I don't know if anybody has any specific questions they want to ask. Let me bring my chat box up. There more? Let's see. Here we go. So feel free to ask questions in the chat. Okay. I know you said if a school-age child is getting therapy at school, you will work to be congruent with, yes, with the therapist they're working with. But what if the client is not school age but is receiving ECI therapy? Are you able to work with that? Yes, we are. Or would it be on the other? Would it be dependent on? So, all right. Yes, we work directly with ECI, but remember, ECI is going to age out at the age of 3. So typically, years ago, back in the old days, ECI was a free service. Sometimes it is now, sometimes it's not, sometimes it's on a sliding scale. We're actually accessing, Nicole, our Medicaid provider at your office is Cook's, correct?
Yes.
So that's the Medicaid provider that we're working directly with. Typically, if they're in ECI and Medicaid's funding the ECI, they're going to have you make a choice. Do you want to be in ECI or do you want to be in an outpatient therapy center? So you typically would not be in both because those services are being provided through ECI. At the age or before the age of 3, they're going to ask that you transition out to the school at that point because ECI will finish. So I hope that answers the ECI question. If there's more that I missed, let me know. But typically, we are not working together with ECI because we're drawing from the same funding source. There's no difference in what ECI is doing versus what we're doing. The ECI comes into the home. That's the only difference. We're an outpatient center. So home is great when they're little, but as they progress, we're not able to provide the challenges and the training in the home setting. So we move to a center-based setting. Any other questions we can answer for you guys? Any Spanish questions? Amanda is here. And if there's anything I missed out on that I didn't make clear, please let me know. But typically for our clients, I have clients in all my centers that are very young with Down syndrome and also quite old with Down syndrome. We're also working with our young adult clients on trying to achieve the skills so that they can go to the day hab programs of their choice to be successful. Sometimes there's a limit when they finish school and they're not at the level they need to be for those day hab programs. So we're working directly with them and helping them obtain those skills to get in those day hab programs.
I don't think we have any Spanish speakers on here tonight. So
any other questions I can answer for you guys? Are many of you receiving therapy services outside of the school? Do you guys know the difference between the school model and the private therapy model? It's very, very different. So the school model is going to be only what's appropriate in the educational setting. That's their scope of practice. Ours has to be holistic. It has to cover all areas. So typically For OT, they're going to be working maybe on handwriting and fine motor skills only, because that applies to the school setting. Understand, I can tell you as a parent, it's very, very different. It's not apples to apples. So if your physician is telling you just get therapy in the school, it's only what's educationally appropriate. It doesn't, I have to follow a medical model. So it has to go in all settings, not just the school. Okay. We did get a question. Let me read quickly.
Oh, no, she just kind of clarified.
Okay.
If you scroll down,
I know you said, okay.
it starts with the F.
Okay, clarified what I was wondering. So at the age of 3, yes, at the age of 3, they will be out of East. Actually, they start transitioning them prior to 3 because they have to be done at 3. And yes, at that point, and our Medicaid provider is Cooks. Yes, we see outpatient, in home, and at school. And yes, if you're with a little one at home, I think it's great. My concern is if your child is going to school and not homebound, they're going to have a much greater challenge in an outpatient center, because we're able to provide a lot of different opportunities. Your therapeutic value is only as much as you can do at the home. I did home health for years. It's great. I love it when it's appropriate, but when the child's not homebound anymore, we can present so much more to them and challenge them so much more with what we have in the outpatient centers. Although these days we're on telehealth, aren't we? So we're in the home and working with families there. But I'm hoping in May we will be able to return to centers. Actually, Nicole, you still have how many? You still have the majority of your clients coming in clinic.
50% coming in right now, or 50, almost 60%, I think.
Yes. So in Allen, it's more like 30. In Mansfield, it's 50 to 60. And we're doing probably we're doing 45% telehealth, where you're probably doing 25 to 30. So it's interesting by area how that changes. I can tell you, we have masks, we have gloves, we take temperatures, we spray everything off. We have to be, the waiting rooms are not really a waiting room anymore. It's more of a transition spot. We have to be very safe. We are very fortunate that in our DFW locations, we have had no clients with COVID and no staff with COVID. So I think we're doing a good job.
I did want to say too, what you were saying about schools is, the medical models looking at the child like overall as a whole, but also time-wise, schools get a very short amount of time.
Yes. Oh, yes. See, that's a good point. So typically, like I'm doing telehealth with one of my young adult clients that's in high school, and he's getting 15 minutes of speech telehealth a week with the school, and he's getting an hour of telehealth a week, 230, no, he's doing 2 45-minute sessions a week in outpatient. So it's a very different, the funding and the time works very different. With school, it's shorter. It'll be 15-minute increment, once a week, 20 minutes. And some of it is direct service and some of it is consult, which means they're consulting with the teacher on how to implement what's happening versus them working directly with the client. So that's school. School has direct service and consult. And I mean, I totally agree with what they're doing because it's for their educational setting. Their goal is, but overall, as a parent, you have to decide where you hope and dream your child to be as they grow up and where you want to see them going. This is something, I've raised 2 young men. I've worked very hard to get them to where they need to be, but I can tell you, I couldn't rely entirely on the school. I couldn't rely entirely on medical. I choose to do both, and they work together, and I work with other Medicaid outside funding sources. I'm a believer of provide as much as you can, as early as you can, so that you have an opportunity for them to progress forward. I'm a mom more than, an OT, but I'm a mom. It's my job at some point, I won't be here. So I have to do everything I can to set up those young men to be able to be as successful as they can be. And what I realize is I've been doing this for years. And so I'm like, seriously, where can I go? Where's the next place I can go? The more, the better, the more people they learn to work with. But everybody has to be on the same page. It's really, really important. The reason I added behavior services in Allen and Will in Mansfield is because I think the behavior people need to be working with the therapists. We all have to be able providing the same instruction when they're learning so that they eventually learn and generalize the skill. It's not a learned skill if you can't do it in every setting. So if you can handwrite in school, but you can't handwrite in home, that's not a generalized skill. A generalized skill is a skill that can be applied to any setting and any person. So if your kiddo can work great with their teacher, but then a substitute comes in and they can't work with a substitute, that's not a learned skill, right? So the reason this is sort of my mantra is it's our job as parents to do the best job we can case managing and communicating with providers and making everybody work as a team. If you have a provider that will not work with the team, that's not a provider with your child's best interest at heart. If they won't take 5 minutes to make a phone call, that's where you as the parent have to make a decision, what is best for my child, young adult, baby, whoever it is, so that what we know is they all have a potential to grow, right? And they all have the potential to gain skills. Some move quicker than others, but something is better than nothing. So we continue to dredge forward. My younger son was moderate to severe. They said he would never talk and that he would never function. And he attends a day hab at My Possibilities. He is able to go out to some work settings. So don't ever believe the limitations. My younger therapists often say to me, I am surprised that I underestimated that client's ability, because when I push them slowly, I was able to get them to do more. So you never know. Continue to push, because the goal is we want them to be, as adults, in the best program they can be in. And the best programs require them to have skills. They really do. You know, the way the funding works in Texas is they don't get paid any more to deal with the clients that are low functioning than they do with the clients that are high functioning. So what happens is if I'm a day hab owner, and I know I'm getting the same amount for each kiddo, why am I going to take a child that has challenges when I know I'm going to get paid the same for someone that has no challenges? That's the reality of it. I'm sorry to tell you that, but I'm a parent and I know it. So as you work in these Medicaid waiver programs, which my boys are on class, so I can tell you I'm very familiar, it's your job to get them to where they can comply and learn to adapt to our environment. I understand it's like a square peg in a round hole, but you have to be able to do that for your kiddo, because one day when you're not here, they need to have the best options open for them. So that's my Reader's Digest mantra. That's why I do this. My goal is to be able to help every child and parent get to their maximum potential. So just think in terms of that when you make decisions, because, you know, I get parents say, oh yeah, I get 15 minutes at OT a week at school or whatever. What is that going to translate into? It's my job to make sure I give them every opportunity to move forward. So you guys are welcome to reach out to us. Nicole is on the call. Nicole is the office manager at Mansfield. She's a really, really nice, great lady. And talks to our parents a lot. You can reach out to me directly if you want to, if you have questions or concerns. I'm always here. I do a thing called Bend an Ear. I'm always here to help parents. You don't have to be a client at our clinic. I don't want to see anybody have to go through what I went through, because I've been doing this 27 years, which is a long time. So I have a lot of history behind me. And if you need resources, Nicole has a jump drive with resources in your area that we know are alive and well and still providing services for you. Or if you just want to come and have a cup of coffee and sit 6 feet away and chat with her, you're welcome to do that. Okay. So we hope this was helpful for you guys. And if there's anything, you're welcome to have the PowerPoint, take these activities. We wanted to give you something to practically do, because this is a rough time and your kids need to move and they need to have enriching activities.
Great. All right. Well, thank you all so much for coming on here and working with us on Zoom. And thanks everyone for logging on. So yeah, well, I have the PowerPoint and I can send that out
My email is up there, you guys, so you can email me. I'm not a scary person. So the goal to do this is to help you, because I'm a mom like you guys. I'm a mom before, I'm a therapist, but I'm a mom. So I can tell you, I see this from both sides of perspective. So you know what? Take advantage of every opportunity you have to make your kiddo the best they can be.
All right. Did anyone else have any other questions for them? Y'all can unmute yourself.
You definitely can.
Yeah. If y'all have any other questions before we close out? No?
We appreciate being able to do this. We love connecting with families, even if it's on Zoom.
Yeah.
And Heather, if you have any questions in Spanish, feel free to send them to Nicole or Kate, and they'll forward it to me.
Yes, they will forward it, and Amanda will go ahead. Amanda is also, she was our student coda, so she's a mini therapist too, so she's a great resource for us.
Okay, yeah, I'll send them your way, and I might get some questions after this from our Spanish speakers on how to connect with you guys. So I'll give them the information so that they
Wonderful.
Yeah, but I did send them the PowerPoint in Spanish, so they wanted to log on and follow along. They were
Yes.
It was okay to do that, so we'll get that worked out. So
Absolutely, and if anybody needs referral sources, Nicole's gotten pretty good at all that on, different places they can go. We love you coming to Cutting Edge, but if you're not close to Mansfield, don't come to Cutting Edge. Nicole can tell you where to go, where you can get services near you, and it's not strenuous. You also, if you're Medicaid families, even if it's Medicaid secondary, you have to make sure they're a provider for your Medicaid. So that's important.
all righty.
All righty. Well, thank you.
Wonderful. Thank you very much.
Thank you so much. You all stay safe out there. I think you're going to open up your county before we do over here. You're doing a lot better than we are, I think. I don't know. Dallas has been good. Collins pretty good where we are, but Dallas, I don't know.
Yeah, I know. That's what I keep hearing. So
we'll see over
here.
Who knows? The new normal.
I don't even know when we're supposed to come out yet.
You know what?
Every day.
You're going to find out next week, the end of the week. That's what I think.
Yeah.
And like I said, we still have families coming out. They said, "Are you kidding me?" All we do is go home, go to the grocery store, and go to Cutting Edge. That's what we do. Yeah. And we all come in, the therapists come out, and we're like, "You're going to learn to wear a mask. We're going to teach you to wear a mask." So, absolutely. Well, thank you all so much, and be safe out there, okay?